Chapter 31: Antimalarials, Antihelmintics, and Peptides. Malaria. This was a life threatening disease that was eliminated in the early 1950s. It's caused by a protozoa with an incubation period of 10 to 35 days, followed by flu like symptoms. The phases begin in the tissue with the invasion of the body, though no symptoms are present. From there, it moves on to an invasion of the red blood cells, resulting in symptoms like fever, chills, and sweating. The treatment regimen depends on the type of plasmodium and the organism's life cycle, as well as the combination used for drug resistant forms of malaria. There's some prophylactic measures, such as chloroquines or hydroxychloroquine, will actually be prescribed to people who are traveling to areas at risk for malaria. There are many different eradication methods, ranging from prophylaxis, the treatment for acute attacks, as well as the prevention of relapses. The side effects and adverse reactions would include things like GI upset, retinal damage, eighth cranial nerve involvement, renal impairment, and cardiovascular effects. That retinal damage, especially, makes it important that you get a baseline vision test before a patient begins these antimalarial drugs so that we can identify any vision loss early. Helminths, or parasitic worms. Transmission occurs in poor sanitation and hygiene and results in entry from infected soil to humans via contaminated food, bites of carrier insects, or direct penetration of skin. And they can infect things like the intestines, lymphatic system, blood vessels, and liver. The classifications would be things like tapeworms, flukes, or roundworms, or even nematodes. Antihelmintic drugs, they destroy parasitic worms, usually given 1 to 3 days, and have side effects that include dizziness, drowsiness, headache, weakness, and GI distress. For the nursing process, it would include an assessment to assess whether the patient has traveled out of the country to a malaria endemic area, and also to obtain a patient history of both malaria as well as any anti-malarial drugs given. We want to carefully monitor the renal and liver function by checking urine output as well as liver enzymes. Monitor the patient for any impaired consciousness, headache, or seizures, and carefully monitor any patients returning from a malaria endemic area. Peptides. These are broad spectrum, powerful defenses that kill parasites, fungi, and viruses. They work by interfering with the bacterial cell wall, causing cell death, and can be classified into things like antiviral, antimicrobial, antifungal, and antiparasitic. Peptides could take many forms, such as closamethate to treat Pseudomonas, bacitracin to treat most gram-positive and some gram-negative bacteria, or metronidazole used to treat Trichomonas or Helicobacter pylori. Side effects would include things like hypersensitivity, anaphylaxis, dizziness, headache, slurred speech, GI distress, respiratory distress, pruritus, rash, fever, and skin redness, just to name a few. In the case of antihelmintics, we want to assess the patient for any anal itching, abdominal discomfort, assess whether they've traveled outside of the country, and obtain a history of the foods the patient has eaten and how the food was prepared. For planning, the patient will need to demonstrate hand washing before eating, and the patient will also have to explain how to prepare foods properly to avoid any recurrence. For peptides, we again want to obtain a health history listing all prescribed and over counter medications the patient could be taking. We also want to assess the patient's prior use of antibiotics, as well as the use of multi drug regimens and the presence of any untreated infections. For planning, the patient's skin will be intact without pruritus, swelling, or rash, and the patient should also be able to identify any dose and explain how to properly take the prescribed drug. The patient will also describe the side effects and any adverse reactions that will require notification of the healthcare provider. For practice question one, what is the most appropriate nursing intervention for a patient who is taking mefloquine and hydroxychloroquine? That be A, collect a stool specimen, B, assess the patient's hearing, C, advise the patient to take showers, not baths, or D, encourage female patients to have a pap test every 6 months. And that answer is going to be B, assess the patient's hearing. Question 2. Travelers visiting malaria infested countries are instructed to A. Avoid mosquitoes in these countries, B. Receive immunizations before travel, C. Visit these countries only while in good health, or D. Take prophylactic antibiotics before traveling. And that answer is going to be D. Take some form of prophylaxis before traveling. Question 3. Which information will the nurse include when teaching a patient about antihelmintic therapy? A. Take the medication 1 hour before meals. B. Take a bath at least once a day. C. Change your sheets every other day. Or D. Be aware that drowsiness may occur. And that answer is D. Be aware that drowsiness may occur. And for our final question, the nurse is aware that most patients receiving metronidazole are being treated for infections of the A. Urinary tract, B. GI system, C. Integumentary system, or D. Reproductive system. And that answer is B. Gastrointestinal system, GI system. For these more complex organisms like protozoa or parasites, they take a more complex drug to kill. But unfortunately, that also does result in some more complex side effects as well. But anyway, that's all we got for this chapter. I'll see you in the next slides.